Septic arthritis. So far, we have discussed many causes of arthritis, such as SLE, rheumatoid arthritis. There can be arthritis in Sjogren syndrome as well, in scleroderma as well. The arthritis that is present in SLE and in rheumatoid arthritis, they are basically polyarthritis. Polyarthritis and symmetrical arthritis. What is a polyarthritis? Polyarthritis means they affect many joints. And then we discussed migratory oligoarthritis or polyarthritis. That was a feature of Ritter syndrome. Now we will discuss some causes of monoarthritis. Monoarthritis means the arthritis is that affect a single joint, or there's a single joint involvement in these type of arthritis. So the first cause of a very important cause of monoarthritis is septic arthritis. Septic arthritis is a very important topic, and every single detail that we are going to discuss is very important. So that's why you need to remember all of these. Remember that rheumatoid arthritis is an important risk factor for septic arthritis. It is usually given in a stem as a hint with other features of septic arthritis. So someone with a history of rheumatoid arthritis present to you with fever, pain, swelling, and hotness of the knee joint, you will suspect septic arthritis. Other risk factors for septic arthritis, they include diabetes mellitus, steroids, HIV. So along with rheumatoid arthritis, remember these risk factors as well. Someone with a history of diabetes mellitus, abuse of steroids, and HIV, all of these three conditions, they will lead to immunosuppression. So you can say that septic arthritis, it is common in immunocompromised patient. So a diabetic patient with a swollen knee, a patient on steroids with a swollen knee, a patient of HIV with a swollen knee and fever, you will suspect septic arthritis. Septic arthritis more commonly affect the knee, but it can affect other joint as well, especially shoulder joint. The commonest causative organism of septic arthritis is Staphylococcus aureus, while in sexually young and active uh, people, Neisseria gonorrhea can also cause septic arthritis. Now, the diagnosis is made on the basis of culture and sensitivity of of the synovial fluid. Synovial fluid, the fluid that is present in joint space, that will be aspirated and it will be sent for culture and sensitivity. And because it is an infection, a bacterial infection, so blood culture will also be done to see if there is any sepsis or not. Management is very simple because the cause is bacteria. So, and the bacteria that causes septic arthritis is Staphylococcus aureus. So, anti-staphylococcal penicillin such as fluoxacillin can be used in the treatment. It can be started empirically before the synovial culture results, and then depending upon the results, we can change the antibiotics. And if the person is allergic to fluoxacillin, then we can give clindamycin. And if the causative organism is Neisseria gonorrhea, not Staphylococcus aureus, then we will give ceftriaxone or cefotaxime. And if the patient is not responding to these antibiotics, there's still swelling and fever and pain in the joint, then because inflammatory fluid is accumulated in the joint space, so we'll do repeated percutaneous aspiration, like we do for abscesses, that is drainage and antibiotics. So if antibiotic alone patient does not respond, then we'll do repeated percutaneous aspiration. Usually, IV antibiotics are given for 1 week until the blood cultures become negative and swelling resolves. Then the patient can be shifted to oral antibiotics for 4 weeks. Do not forget these risk factors for septic arthritis. Why again and again I am emphasizing on this point? Because the presentation of gout and septic arthritis, they will almost be same. So that's why you need to remember the risk factors for septic arthritis. Because if we are suspecting gouty arthritis, then we'll send synovial fluid for microscopic examination and not culture and sensitivity. So that's why it's important to remember when to suspect which condition. So this was all about septic arthritis. The most common cause of septic arthritis is Staphylococcus, and the cause in sexually active young people is gonorrhea. The features, the risk factor for septic arthritis is immunosuppression and rheumatoid arthritis. Immunosuppression include diabetes mellitus, someone on steroids, and someone with a history of HIV. The investigation, they include culture and sensitivity of synovial fluid and blood culture. Antibiotic fluoxetine, and if allergic to fluoxetine, then clindamycin. And if we are suspecting Neisseria gonorrhea, then cefotaxime or ceftriaxone. And if someone is not responding to antibiotics, then we need to do repeated percutaneous aspiration as well as continue antibiotic. So this was all about septic arthritis.